Hello and welcome back to my YouTube channel on histological techniques. We've just started back teaching for another semester here at QUT in Brisbane, and I thought I would use this as motivation for me to release a more regular series of videos. And to help guide us through that, I thought I would follow the content that we're covering this semester. It's a little bit more advanced than some of the basics, which I've covered in a lot of the other videos that I've posted already. The advantage of that is that we can cover some topics which I've yet to cover. So the topic that I'd like to cover this week is pigments. So what are pigments? How do we deal with them in histology? Do they have any diagnostic significance? Or is it purely something technical? Well, it turns out it can be all of those things. In this particular semester, we look at pigments as the first topic as a way of reminding ourselves that despite the fact that we spend a lot of time learning how to apply different dyes, stains to tissue sections in order to demonstrate various structures, we sometimes come across color that is already there. And that's essentially what we are referring to when we're talking about pigment. Okay, so pigments are, I won't say naturally occurring, as we'll see, but they are present already within the block of tissue prior to sectioning and applying any stains to the section. So to help get us off to a start with talking about some of the types of pigments and what they look like, I'll just cross over and share my screen to, this is actually a link to the online course. We have obviously a similar course here at QUT, but this particular one that I'll share here is the version that's available through trainee membership to my YouTube channel, called Essentials of Histological Technique. And we're actually going to jump quite a way down through the various topics here. So a lot of these other topics, I'll just highlight that. These are basically covered in many of the other videos that I've already posted to this YouTube channel. But today I'd like to just, by way of example, show you how this course works by focusing on lesson 14, which is identification of pigments and minerals. So I won't bore you with all the details. We'll sort of cut to the chase here. There are some learning objectives there and sort of brief description of pigments. So I think we've already covered that in my introduction by describing pigments as, I guess, a source of color that is already present within the tissue prior to actually applying any stains. So what are some of the types of common examples that you may come across? So there's a series of animated images here as a way of a short quiz. And so these are all H&E stain sections of various tissues. You may be able to see that's some skin through here, and we've got some liver, although it's a bit difficult at this magnification and this limited view to be sure what we're looking at. But you can see in each of these panels, there is some very prominent material which we wouldn't otherwise expect to see within a H&E section. Okay, so remembering that H&E, hematoxylin and eosin, we're expecting to see a combination of blue to purple color from cell nuclei, as we can see quite clearly in this area here. And the remainder, usually protein, whether it's collagen or red blood cells, muscle, etc., will usually be stained up with the eosin. But we see in each of these examples, perhaps less so over here in the skin, but there's color other than red or pink and blue. So these are examples of pigments. So what are they, and how confident would you be in being able to identify them? Well, I think an experienced histologist would be able to have a pretty good guess, at least with some of these. this is liver on this far side, and so the type of architecture and sort of shape, distribution, however you want to describe it, of these yellow-brown globules would be consistent with the appearance of bile pigment. Okay, so whether or not you would know that or not, if you were looking at liver for the first time in a H&E, that may not be the case. And so as histologists, either diagnostically or in research, it's useful to have a way of being sure, what is that particular pigment? And to be sure that it's not necessarily this one over here. So again, it's yellowy brown, it's kind of globular in appearance. Can we assume that that's just bile pigment? Well, maybe, but in a diagnostic setting, it would be no doubt unsafe to assume that. In fact, these are melanoma cells that have metastasized to liver. So you can see straight away from those two very simple examples there of liver with some brown globular looking pigment that it's really important that we have a way to identify, diagnose those sorts of pigments. Now, we'll be talking a little bit about melanin today. There's a very simple test that can be done to bleach the color of the melanin. And we'll also be talking, probably next week, I'll release another video where we'll talk about reactions, chemical reactions that can cause color changes, both to bile salts in the case of this bilirubin that you saw there in the first image. And in the case of melanin, we can exploit a different chemical reaction to provide evidence of that being melanin. Okay, so how about these other ones? Well, this top one here, the top left, how would you describe that? In this situation here, it looks kind of black, a bit globular perhaps, but also slightly crystalline. This actually, it's may not be something that you come across every day, but it is something that you'll come across if you don't pay good attention to buffering of your formaldehyde. So if you're using formalin as your fixation agent, which is still the most commonly used fixative, if the pH of your formalin is not buffered at or around neutral pH, if it becomes acidic, and so if the tissue is being stored under those conditions for some time, what you can get is a reaction product between the hemoglobin in the red blood cells and the formaldehyde under acidic conditions to form what is known as formalin pigment. And so that's what we can see in this example here. So that's obviously not of any diagnostic significance, but it could well interfere with your ability to see structures of diagnostic value. And it also doesn't look very good either. Obviously, if you're trying to present your best H&E and you've had some tissue that hasn't really been fixed optimally, and now you've got all this pigment through your section, then it would be nice to have a way of getting rid of it. And I'm glad you asked. There is. So we'll briefly show you how to do that. So we've covered 3 different pigments here. What are these other ones? Well, probably no surprising. Let's dispense with this one over here. You may be able to make out that this is a section of thin skin, and this is actually melanin, but we're not talking about melanin in melanocytes, or certainly not melanoma in this situation. What we're looking at is most likely melanin granules that have been deposited within the cytoplasm of these basal keratinocytes. And that's quite normal, part of the normal anatomy, physiology of these cells. They like to recruit melanin from the melanocytes that are wandering by, and they like to use that as an umbrella to protect themselves from damage from the sun. Okay, so again, the other important feature here, coming back about pigments, is it's really about context. So even in the case of things that are produced normally endogenously within the body, the location has obviously a big impact on the context here, as compared to the liver. that would be quite a concerning observation. And then finally, we've got two other probably less prominent areas of colour. You may not be able to make out too clearly. That's kind of browny yellow here. Looks a little bit more yellow in this example here. What are they? How are they different? Well, to be honest, as you go further looking at some of these things, you really do need to have some technique to identify them, to be sure. What are they? Well, this one here is what you get when there is toxic levels of iron which accumulate within tissue. It will be converted to this material called hemosiderin. Because of the high iron content within that structure, the good news is that we have a way to identify that histochemically using a stain called Pearl's stain, and we will cover that in the next video next week when we cover it in the class next week. As for this final one down the bottom here, this is according to our notes that we have and the way that it's been identified subsequently. This is lipofuscin or age pigment. The best way that I find to interpret what lipofuscin is that as cells get older and age, they just get a bit lazy, as we all do with age, and we're less efficient at taking out the garbage. So you can get accumulation of these metabolites, breakdown products within the cell, and rather than being efficiently discarded and recycled, they just tend to accumulate. And so we'll talk more about how to identify that next week as we talk about the sorts of chemical reactions that can be used to demonstrate those. As it turns out, there's a lot of similarities histochemically between melanin and lipofuscin, which enables us to use fairly similar techniques. Okay, so I've already alluded to the fact that there are different categories of pigments in terms of, I was mentioning how melanin can be regarded as an endogenous pigment. Turns out we can really define endogenous pigments into at least two broad categories. Those such as melanin and lipofuscin, which are in sort of one separate category as being non-hematogenous, that is that they're not derived from the breakdown of red blood cell products derived from hemoglobin. And then we have others like the hemosiderin that we saw there before, because it's related to iron accumulation, which we often regard that as being of a hematogenous nature. Okay, so the two main ones that we've seen there, which fall under that category of being hematogenous, would be the bile salts here, the bilirubin, and the hemosiderin. Okay, so collectively we can refer to those things as being endogenous, but they can be further defined by their nature of origin as either being of hematogenous or blood origin. Of course, there's other ways to accumulate iron within the body via another route, but generally we can refer to that as being hematogenous. And then by comparison, things such as melanin and lipofuscin, which are non-hematogenous. With respect to formalin pigment, the terminology that we use for that collectively is artifactual pigment. And so these are things that are a consequence of the handling of the tissue after it has been removed from the body. And so generally a combination of how the tissue's been fixed, how the fixation has been buffered, which we see here in the case of formalin pigment. But there can be other types of pigments, probably less common, fixatives that have been based upon use of mercury. Were popular many years ago, and you may find some archived material which was fixed in that way and then subsequently processed into paraffin. And what you can often find with those sorts of alternative fixation methods is that you can get precipitation of either the mercury or chromate is another one which has been used historically, and they can precipitate as the tissue starts to undergo processing through the alcohol. And so, yeah, collectively, these are things we refer to as artifactual pigment and have nothing to do with the patient or the subject that we're looking at histologically, but it simply relates to changes that have taken place chemically within the tissue during the handling, the fixation, the processing, leading to production of pigment. Okay, so I think we've sort of covered the broad spectrum of pigment types. And as I said, we'll be talking next week in the next posted video about some staining techniques or reactions that can be used in order to help you distinguish between these various pigments. But today, to complete this video, what we'll discuss is some very simple, straightforward procedures that can be employed that will be equally of value to helping to identify or maybe to improve the quality of a section, as in the case of the formalin pigment. So is there a way that we can remove that? And thankfully there is. So just very broadly, what are the things that you can do to help you to identify pigments within tissue? Well, we can define them as either being solubility tests, that is to dissolve, to remove the pigment, bleaching, as we'll see today in the case of melanin pigment, and the ones that we'll look at in the next video, conversion to a different color using a special stain, although correctly speaking, it's a reaction. So, unlike some of the things that we've seen in other videos where we can take a stain or a dye that has a color and we bind that to the tissue, these reactions actually involve histochemical changes within the pigment to convert it from one color to something else. Okay, so there is a table that I present within the online course which provides you with a nice reference to the various things that can be used. The ones that we're going to discuss now over the next few minutes will be the use of saturated alcoholic picric acid as a way to remove formalin pigment. It also works on malarial pigment as well if you've got an issue with that. Although I haven't mentioned it, it's a very similar sort of chemistry to how malarial pigment is formed. Obviously, there is a role for infection with the malarial parasite, but its chemistry is such that you can also remove it using saturated alcoholic picric acid. Then the second one that we'll consider today is how to remove, that is by bleaching, melanin pigment. And what we use that to remove that or to bleach that is acidified potassium permanganate, followed by brief treatment in oxalic acid. And the reason why we do that is because the potassium permanganate itself causes a kind of brown discoloration of the tissue. So obviously that's not ideal. You want to remove that before going on and doing a H&E or something else. Okay, so those are the two that we'll look at today. Next week in the next video, so that this doesn't become way too long, we'll be looking at some various reactions, including Hall stain, Pearl stain, and Schmoll stain, which, as I've said, these are reactions that have the property of converting those yellow-brown pigments that we've just seen into a nice vibrant color that helps to be able to demonstrate it clearly and to distinguish it from other things. Okay, so I'll stop sharing the screen there and we'll switch over to the microscope, and this will give us an opportunity to look at some slides, some actual examples. And as I said, today we're going to look at formalin pigment and melanin, and we'll look at the results of these procedures that have been applied in order to clean up the section. So we'll switch over to the microscope here. And I'll just enlarge that so it's a little bit clearer. There we go, bring that to focus. Okay, so you may, depending upon your level of experience, you may actually be able to identify this H&E section as being of placental tissue. Just try and focus that a little bit better there. So we can see there we've got those chorionic villus structures. There is obviously some fibrin in there, although we haven't specifically stained up for it using a trichrome, but morphologically looks like we've got some fibrin in here, obviously a lot of red blood cells, and we've got some nuclear staining of the amniotic epithelium, as well as these chorionic structures as well. The reason why this looks so, how would you describe it? Little globs of islands of structures is because relating to the internal structure of the placental membranes and how the chorion, when it pulls away from the uterus, we have these undulating structures, and even the placenta itself has got a degree of folding that takes place once you've actually sampled that, processed it, put it into a block, and so we get this island-like arrangement. Okay, but what I would like to draw your attention to, if we go back to the higher magnification, is that this particular block provides us with an example of formalin pigment. I've just got a bit of a wonky stage here at the moment, but you see there's these sort of black crystalline materials here, a little bit further on over here on that side. Let's just scan around a bit more over here as well. Now, is that a problem? Well, an experienced histologist may be quite familiar with coming across that and has no issue with it. Likewise, pathologists responsible for making diagnosis are probably not going to be overly concerned by that. But it could, in a number of cases, there's a lot of formalin pigment in that area there, it could, in many circumstances, be detrimental either to clearly obtaining observation of structures that are of interest to either a researcher or a pathologist, and it just doesn't look nice, you know. So obviously it indicates something about the technique that has been used, but bear in mind there are clinical scenarios where you can come across this, and I was talking to a colleague briefly this week about it, where he was mentioning it's not uncommon with whole lung biopsies, I guess in the case of failed transplants, where you can come across formalin pigment, so perhaps say more often than in other situations. And so I imagine that's due to the local histochemistry of what's going on within lung tissue, especially in the case of a failed lung transplant. If you can imagine, there can be a buildup of carbon dioxide within the lung tissue, inefficient ability to clear that, and so the acidification of that tissue, I would assume, would then promote or lend itself to having a higher production of formalin pigment. So this is obviously not a case of being sloppy with how the formaldehyde has been prepared or stored or used, but there could be situations where the acidity of the tissue itself is such that it's promoting this reaction when the formaldehyde then is introduced, okay? So however it's been formed, how do we get rid of it? Well, as I mentioned before, there is a rather simple technique for removing formalin pigment. And to do that, it involves taking the section down to water like you would normally do, and then prior to doing anything else, you soak the slide in a saturated alcoholic solution of picric acid. And it must be alcoholic, trust me, because we've made the mistake of bringing out the aqueous picric acid on occasion, just by mistake, and it doesn't work. So just a quick tip for you there, you do need to use the alcoholic version of a saturated solution of picric acid. Now, it's kind of hard for me to show you, where it was and where it's gone from, because what we see now is just little to no signs of any of that black material that we saw before. So if I sort of scan around a few areas here, I'll try to convince you that it's no longer there. There's a little bit of something there, which could potentially be a bit left over, although it could just be a bit of hematoxylin as well. So go a bit further to convince you. Yeah, so I think you get the idea there. There may be small traces, but we're certainly not seeing those large globular looking structures that we saw before. And bearing in mind, there might be a little bit of precipitated hematoxylin in there as well, okay, which obviously won't be necessarily removed using this particular technique. So one thing that you may have picked up on the earlier slide is that wherever we found that formalin pigment, it did tend to associate with areas where there is blood or red blood cells. And, there's certainly many examples of that I've seen. However, it's not always the case. So we had some examples in the class this week. We had some liver tissue which had formalin pigment, and it was quite a disease piece of liver, had quite fatty changes within the hepatocytes. And as the fat had been removed, there were these spaces that were created. And what we could see is these sort of browny yellow, almost needle-like structures that were residing within those spaces. And it was subsequently shown to be formalin pigment, because with the appropriate treatment, it was then removed. So yes, it may be something that is often found associated with areas where there is red blood cells, but it's always best to do the test to be sure. Okay, so it just reminds us of that principle that even with experience, you may think you know what you're looking at, but it is always safer to perform either the solubility test or the bleaching step or the reaction in order to be absolutely certain. Okay, let's switch over now to a different pigment, and as promised, we will look at some melanin. This is a section, I think it's of skin. It's a bit difficult to tell because the architecture has been so dramatically altered by a very large melanoma. There's some collagenous, the color on this is terrible, my apologies. I'll have to actually see if I can adjust that. Let's just exit from there. In fact, I might turn down the light initially, and that'll probably do the trick. There we go. Okay. So, yeah, there's some connective tissue here through there, which you can see looks relatively normal. That could be an area of dermis. There's some blood vessels through there. Not really seeing any other identifiable features to tell us where the location of this is from. But what we can see, especially if we go to a higher power now, and that was probably my issue before, my apologies. I'll just turn the light up there again. Okay, so you can see now in this area, there's some very unusual looking cells. They certainly don't look normal. And many of them have got this prominent yellow-brown accumulation within the cytoplasm. Now, to be honest, it's a little bit difficult to see a nucleus to associate that with a cell. But yeah, you can, with experience, yeah, we can see here there's more of this sort of globular looking material, and that is within the cytoplasm. we just can't see the nuclei very well. Okay, would I be confident, therefore, in just assuming this is melanin? Well, no, it is best to do some type of test in order to be sure that we're actually looking at melanin pigment. So as I mentioned, there is a simple bleaching procedure using potassium permanganate followed by oxalic acid, both of which to some extent will oxidize the tissue. But in combination, it's a very effective way to bleach the melanin so that you can then get a better look at what's going on. Now, this has been labeled as having been bleached, but in this situation, it hasn't actually worked as well as I thought it would. Let's just have a look here. Okay, so we've got sort of partial bleaching. I think so you can sort of see that there. So there is certainly some removal, but it is not actually as complete as you would hope for. If your goal was to completely remove it from the section, for example, there could be circumstances under which, for example, immunohistochemistry, if you're using a brown chromogen like DAB on something like retina, which is something we've done in the past, because you have melanin pigment within the retinal pigmented epithelium, you would want to remove that brown color from the section prior to then performing immunohistochemistry using DAB. In a diagnostic sense like this one, perhaps if you were looking to have a quick assessment as to whether this is melanin or not, this has certainly reduced the level of brown staining, but it looks like for whatever reason that it hasn't done that completely. So I'll just show you another one here. This is actually the same. It does say melanin bleach. My apologies for not checking this beforehand. Okay, well, this one has not actually been bleached either, so it's been incorrect. Okay, so this is not going to be able to show you that any better, unfortunately. Right, so yeah, this is back to the original one, but it just does serve to show you how really strong that level of staining is in the absence of any bleaching. Okay, so I'll switch over back to the one that was meant to have been completely bleached, but it's actually hasn't actually done that completely, but you'll get the idea of certainly there's been a significant drop off in the level of color there. Okay, so coming back to that one there. Yep, so it's not really complete. In fact, there's some areas here where it's almost as brown as what we just saw in the earlier example. Okay, so not a perfect example, but when performed correctly, and I think we'll come back to this next week just to prove that point, just to show you that you can actually remove it quite effectively. Okay, and look, just to end on, as I mentioned, there are alternatives to using a bleaching step when it comes to melanin. There are also chemical reactions that you can use to color the melanin. And so we'll just now refer to this slide. This is actually another section from that same block that we've just seen. And what you can see quite clearly is quite a dramatic blue to green color that is now present wherever we previously had brown. So this is an example of one of these chemical reactions that I mentioned. And this is called Schmoll's stain, and it works on the principle of melanin having the ability to behave as a strong reducing agent. And in doing so, it is able to convert iron salts to this particular color that we can see here. Iron in combination with ferricyanide. So what we're actually seeing here is ferricyanide, and otherwise known as Turnbull blue. Okay. So look, I think that's enough for today. Otherwise, these videos each week are going to be getting way too long. I'm hoping to give you just bite-sized bits of information each week, rather than to give you everything in one go. But that's a bit of a primer, an introduction to pigments. We've seen some alternative ways to deal with them, whether they be artifactual pigments like formalin pigment, or whether they be endogenous and potentially more serious in terms of diagnosis, things like melanin. So we can bleach them, and promise we can do a bit better than that. I'll show you another slide next week. Alternatively, as we'll spend more time looking at next week, we can perform these reactions in order to provide an alternative way of demonstrating these particular pigments. Okay, so thanks for your attention. I promise to have more of these coming on a more regular basis, and I'll see you next time. Bye for now.